Hi, I'm Dr. Katie Woodley, the natural pet doctor. In this short video clip, we're going to go deep into what pet wellness truly means for your dogs and your cats. If you want the full video course, make sure you check out the link below for our pet wellness course, which is going to go through nutrition, vaccines, and all the different life stages of your dogs and cats and how to optimize their wellness. Please leave a comment in the comments below and make sure you subscribe so that you get access and updates whenever we upload new videos to our YouTube channel. Thank you. All right, so vaccines, we've covered a lot of this already. This is very similar to what we just talked about in the last module. So once again, we're looking at now, so 1 year of age. So this is when your dog and your cat are now coming into the vet clinic for their booster vaccines. So we talked a little bit last time about whether or not you can titer or if you just need to booster that vaccine. Either are fine at this point. But now what we want to do is from here forward, you want to actually be doing those vaccine titers to ensure that your pet truly needs those vaccines. We can't titer all of the vaccines that we give, but we can make sure that they truly need the ones that we can titer for. So for dogs, that's going to be your distemper and your parvo. Like I mentioned earlier, rabies. If your pet has a life-threatening condition, autoimmune disease, cancer, then what we can typically do is write a vaccine waiver. And we cannot titer the leptospirosis vaccine and bordetella. You need to do these if you live in an area where these diseases are common, or if your pet is being boarded or goes to the dog park. So leptospirosis doesn't have to be given if they're just boarding usually. That's usually not a requirement. You may also see a lot of kennels requiring the flu vaccine. They require it, you don't necessarily have a choice. Just make sure that you're separating out the vaccines. If you're having to give multiple vaccines, make sure that you're separating them out by 2 to 3 weeks. So if you have to give lepto and you also need to give bordetella, just make a separate visit. And then that way you're not overloading your pet's immune system and potentially creating issues down the road. In terms of your kitties, the panleukopenia, so you can do a titer for that. So our FVRCP, so that's going to check for colices, herpes virus, and panleukopenia. That's our all-in-one kitty vaccination. That one is typically required every 3 years. Your rabies, it's going to depend on the type of vaccine that's given. You do want to ask for rabies-free, or sorry, not rabies-free, a thimerosal-free vaccine for your cats. Cats, unfortunately, are really good at forming sarcomas that can be related to the vaccine and where it's given. These, if they do develop them, are very, very hard to get rid of, even through surgery. They're very invasive. They grow really fast. They cause a lot of pain, skin irritation. They break open. They're not good. So this is why it's really important to make sure we're vaccinating cats appropriately and we're not overdoing it, because they're really sensitive to injections. So that also goes with any other injections. In terms of cats, a lot of times we're giving an antibiotic called Convenia because it's convenient and it lasts for 2 weeks. So if your cat goes into the vet clinic for a urinary tract infection, make sure that it truly has a urinary tract infection. Make sure that they're getting a urine sample, they're checking a urinalysis, even potentially running a culture, because a lot of cats don't have bacterial infections. They get what's called stress cystitis. And what that means, it's like human females, we're unfortunately like kitties, which may not be a problem, but sometimes we're a bit sensitive to stress. And what happens is our body doesn't regulate appropriately. And when we're stressed, what happens is our body actually creates inflammation in the bladder. And the symptoms that we see mimic a bacterial infection. The cats have to urinate frequently. They're usually urinating outside the box. You might see blood in the urine. So that's why it's really important. And this is not a bacterial infection. So we need a urine sample. We need to ensure that there is actually bacteria present before we're giving these injections, this antibiotic. things like that. We do not want to create more resistance in the world that we live in right now. There's already enough antibiotic resistance. We do not need to contribute to it. That is my spiel on that. So a little bit of kind of off the beaten path of vaccines, but cats are sensitive. We need to make sure we're limiting the amount of injections that they get, or it can potentially lead to these sarcomas down the road. And that ultimately leads to you putting your pet down, which we don't want. If your cat goes outside, we do need to vaccinate them for feline leukemia, or if they go to a boarding facility, feline leukemia is easily contractable through saliva. So if they came into contact with another cat and they groomed each other, they now have leukemia if the other cat had it. So it's one of those things where it's easily passed on. So if your cat's going to be in contact with other cats, it's definitely worth giving. Remember, if you're having to give more than one vaccine, though, split it up by 2 to 3 weeks. And titers, once again, if you can titer, especially for your pups, make sure that you're titering to see if they truly need those vaccines, because a lot of these vaccines do last for 7 or more years. But we have to make sure that your dog or your cat is actually a vaccine responder. So we mentioned this last time. You can actually have an animal that is a non-responder, meaning that they don't mount an immune response to those vaccines, which creates a whole nother issue if they come into contact with that disease. So for example, a dog has been vaccinated, we didn't check a titer, the pet owner decides not to vaccinate again because they're afraid of a vaccine. We don't know that this pet was a non-responder, so we feel like they're safe, but they're actually not. And they come into contact with parvo. They get really, really sick. We can treat parvo, but a lot of times they're in the hospital for a couple days, and now you have a $3,000 vet bill. Not good. So I recommend definitely titering. If you're not going to vaccinate, titer. Make sure that they truly are protected, because these diseases are out there. And it is a blood sample that the veterinarian can draw, and they send off to the appropriate labs. And then we find out in 2 to 3 weeks if they have enough antibodies in their system, and we go from there. Rabies, you can titer once again, but there is a legal requirement to give it. So it is a lot harder to not give that one. So you will get pushback from your veterinarian, because it is hard to go against the law. There is that legal requirement. So that is something to remember with those vaccines and titers.